guys, it's Coffee with Marci here at Luminous Spa in New Providence, New Jersey with Medical Director Dr. Richard Maggio.
Good morning.
Good morning. Thank you so much for coming on the show.
You're welcome. Thanks for having me.
I am going to have the vampire facial.
Right.
So this is like really popular and there's a lot of questions about it. I know that people are a little frightened of the vampire facial. But you are going to tell us what it's about and why we should not be, and what it does for us, right?
Sure. So, although the name may sound a little threatening, vampire just refers to the fact that we use your own blood products to create a more youthful appearance. Basically, what we do is we draw your blood, and we spin it down. We separate out the red blood cells, spin it down. And we take out the portion of the serum that has platelets and growth factors in it, and then we re-inject it into your face.
Okay.
And what that does is it causes stimulation of collagen growth, causes your own tissue to gradually build and get a more youthful appearance.
Wow.
It's indicated for full face aging, so it's not indicated just for the nasolabial folds or the marionette lines like the bulking fillers are. So you could use it for full face aging. You use it underneath the eyes. You can use it in those areas. We can use it in the cheeks. And the good thing about it is that it's your tissue, and there's really no risk to it.
Well, that's wonderful because I know that people are very concerned. Women are concerned, and I'm sure men have this done too, right?
Absolutely.
But they're concerned about the risks involved. But being that you're using your own blood, you're saying there are no risks with this.
There's always a risk of bruising. We put a needle in your face, so there's always a risk of bruising.
Well, the bruising.
Right.
Right, but no long-term effect.
No.
All right. So what we're going to do first off is you're going to take my blood.
Correct.
And then it separates.
Then we spin it down, right?
You spin it down. And what's happening as that separates?
So what happens is the way the tube is made, it's basically a tube with some wax in there.
Okay.
That causes the separation of the blood from the red blood cells to the serum.
Okay.
Okay. And then what we do is we take a portion of that serum where we know the platelets are and the growth factors are, and we take that out and then re-inject it into your face. And we get about 9 cc's. We take about 22 cc's of blood, and then we're left with about 9 cc's of what re-injected into the face.
All right. And so what are the first things that you're going to do? You're going to take the blood.
So we'll take the blood, we'll spin it down, we'll clean off your face.
Okay.
And then once the product is ready, I'll prepare it, and then we will start the procedure.
All right, fantastic. So we're going to take the blood now.
Yes.
All right. So this is probably the scariest part, is taking the blood, if you're uncomfortable with that.
Okay.
All right, so we're waiting for that to happen, and we're going to have this procedure done, or I'm going to have it done, which I cannot wait.
Okay.
But let's hear why we age.
Okay, so basically the biggest reason for aging is because the skull changes.
Yes.
Your orbital sockets get wider, your cheekbones get flatter, and your jawbone gets narrower. You also lose collagen and you lose fat, so that causes the face to sag. So you get nasolabial folds, you get marionette lines, and you get jowls. Also, collagen and fat loss results in temporal wasting, so people get indentations in their temporal area.
Okay.
And all that causes the face to age. Okay.
I see you looking at my face. You're like taking it all in.
Well, it's important to assess somebody's face.
I know.
So what we do is, people come to me and they ask me, well, what could I do? And there are plenty of things to do, and they say, what do I need? The bottom line is you really don't need anything. It's really what bothers you. I can look at you.
That's good to hear.
I can look at you.
Yeah.
And you can look at yourself in the mirror, and we can see two totally different things.
Absolutely.
So the key of this is to make somebody, obviously I'm not going to make a 50-year-old person look 20.
Right.
But I want somebody who's 50 to look the best they can look.
Yes.
Maybe even give them about 10 years.
Right. So really these procedures cut about 10 years off of your appearance.
They can.
Yes, they can. All right. So one of the things that I wanted to bring up is there's 2 types of wrinkles.
Correct.
And what are those?
Okay, so there's both static wrinkles and dynamic wrinkles.
Okay.
Dynamic wrinkles occur basically in the forehead or anywhere in your face when you make a face.
Yes.
So if you smile, you get crow's feet, or you get these lines around the eyes. If you frown or you raise your eyebrows, you get wrinkles in your forehead, and those are dynamic wrinkles.
Okay.
After years of making those dynamic wrinkles, the face learns to stay like that. The muscles learn to stay. So you'll get, at rest, you'll have lines in your forehead, you'll have the 11s, the lines between
Yes.
your eyes, and you'll have crow's feet. So when your mother said don't make those faces because you're going to stay that way, there was a little bit of truth in it.
Right.
Okay?
Oh, too funny.
So what happens is that for lines in the face, for
Yes.
wrinkles in the face, we can use a neurotoxin like Dysport or Botox. And those things cause muscle paralysis. They're neurotoxin. They cause muscles to stop working and relax.
Yes.
So what happens is once you inject that into the face, those static wrinkles will gradually dissipate. The more often you have those, the less often you need the medication, the less often you need the Dysport. So I use Dysport here.
Okay.
Dysport is similar to Botox.
Okay.
Basically,
I've not heard of Dysport.
Dysport, there are actually two other types of neurotoxin on the market.
Okay.
Besides, Botox was the one that first came out.
Yes.
There's also Dysport, and there is Xeomin.
Okay.
Dysport is something I use exclusively. I tend to like it because it works a little faster and it tends to last a little longer.
Oh, okay.
So initially it lasts about 3 to 4 months. People, as they continue to get it on a regular basis, that time till they need it again may extend out. So after getting it for about a year, you may need it maybe 3 times the next year, and maybe you can go every 6 to 9 months.
And what's the average? How often do you need to have it done?
Well, people ask me that, when do I have to come back? You
Yeah.
basically see the wrinkles start coming back.
Okay.
So when they start coming back, you just come on in and we can give you another treatment.
And the Dysport does the same thing as Botox?
Exactly, yes.
I see. But you find that it just works faster and lasts longer?
Correct.
Okay. Now, as far as fillers go, what if you're uncomfortable with using fillers? What other options do you have?
So again, one thing that we're going to do today is the vampire facial. Vampire
Yes.
facial is, let me step back. There are 2 types of fillers. There's bulking fillers,
Okay.
which cause an immediate result, and you'll see right away. And those are things like Restylane and Juvederm. They're high hyaluronic acid, and they will immediately fill a space.
Okay.
So nasolabial folds,
Right.
marionette lines, tear troughs will immediately get filled by that substance. However, there are some risks to that. Main risk is vascular occlusion, which means that if the injector is not injecting the right way, or they inject into an artery, you can get necrosis of the skin because of interruption of blood supply to that
And what
area.
is that exactly?
The skin that is supplied by the vessel that gets injected inadvertently will be occluded, and you'll lose blood supply to that area, which causes tissue to die. So you can get areas of the face
Oh,
that
how
can have
scary.
tissue die.
Yes.
Yes. Also, if you inject somewhere around the eye in a certain area, you can cause blindness. So those are things that you don't want to have from fillers, and especially
No.
somebody coming in to improve their appearance. It really is not a good thing to have.
Yes.
So that's one major risk from bulking fillers.
Okay.
However, that doesn't happen that often, especially in somebody who's well trained and well versed in using them. So you have the bulking fillers, which occur immediately. Then you have other types of filler, namely Sculptra is another filler, which is a powder. It's a powder called polyalactic acid, which is the same substance that absorbable sutures are made of. It comes in a powder,
Okay.
and it's sent to me in a powder form, and I mix it with water. And the water merely acts as a vehicle to get the powder where you want it to go.
Okay.
Once the face is injected, the powder is left behind after the water gets reabsorbed in about 3 to 4 days,
Right.
and it causes the tissue's own fibroblasts, or the person's own fibroblasts, to produce collagen, and you get a gradual fill. So it's more of a natural look.
Yes.
And the good thing about it is indicated for full face aging. So temporal wasting, cheek flattening, nasolabial folds, jowls, you can use it anywhere. We also use it for butt lifts. We also use it for,
Okay.
men are using it to increase their
Their pecs?
pecs,
Okay.
their calf muscles. So
Okay.
it's used for a lot of different things.
Interesting.
So-
My husband hates his calves, so
So maybe we
that
can
would be a
help.
fix, huh? That's so interesting. So when we were talking about that a little bit, and you were saying it's a gradual change in
Correct.
your face, so it looks very natural.
Correct. The whole goal of any of this stuff is to make you look more refreshed, more relaxed. The ultimate compliment that you could get from somebody is after you've had this done, if the injector is astute enough to be able to or experienced enough to
Yes.
get this effect, is really, you shouldn't look like you had something done. You don't want to leave here and somebody say to you, what you have done to your
Right,
face.
right.
Because that is no good for you, because most people don't want
No.
other people to know that they had anything done.
Exactly.
And my name is on your face, so it does neither of us any good.
Right.
So I tend to be more conservative.
That's good to hear.
I tend to, the best thing that you want somebody to hear, or you want to hear from somebody, is after you haven't seen them for a while, is, did you go on vacation? You look well rested. Did you get a haircut? There's something different about you, but they can't
pinpoint it. Yes.
I mean, our motto here is everybody should notice, but no one should know.
Yes.
That's really what we go
I
by.
love that. I love that. So you feel strongly about not overdoing it
Absolutely.
on anyone.
Absolutely.
And if someone came in,
I've turned people away.
You've turned
And I
people
tell them
away.
that, they don't need it. Give it a little more time.
Yes.
At least you can get some more out of it. Come back when things are a little more, a little more wrinkles, or you feel that it's, I tend not to overfill people. Tend not to make them look like they had something done.
All right.
The other type of filler is what we're doing today. Is your own PRP. It's platelet-rich plasma.
Right.
And it has, basically what we're doing right now is we're separating out the PRP from your blood.
Yes.
And we're going to inject that back into your face, and that has a lot of growth factors. And the growth factors cause collagen regrowth, cause you to just have a more youthful appearance. And that, again, is a gradual thing too. We reevaluate you at about 6 weeks, and then see if you need another treatment.
Okay.
Typically, this treatment that we're doing today is a vampire facial, or the vampire facelift. It's also done with skin pen.
Okay.
And we take some of that PRP and we put it on the surface of your face and use a skin pen to get it into the skin. And that helps with skin texture, skin tone. We're not going to do that today because the downtime on that is probably about 24 to 48 hours, so I know that being in front of the camera, you don't want to have that done. So we're going to do part of it. PRP we also use here for hair restoration. We also use it for a new procedure that we're doing. It's called Gainswave, and it's used for men who have erectile dysfunction, and we use PRP for that too.
Interesting. Well, there's so many uses for it, and like very beneficial ones. Yes, absolutely. So we have just had blood drawn, and you have separated the blood. So let's hear about this.
Okay, so this is the blood that's been spun in the centrifuge, and it separates. There was a waxy substance in there that separates the red blood cells, which are at the bottom, from the serum. The portion of the serum that has the PRP is in this area. So what I'm going to do is prepare this, take out the top layer, collect this, and then put it into syringes, and then go ahead and go to it.
So this is just so crazy. So what's so interesting about this is that you are actually going to inject this in my face.
Right.
And it's going to overall fill the areas that have started sagging.
Correct.
Because of aging.
That's it.
That none of us can help, but this is going to turn back the clock for us in a natural way.
Right. And the good thing about this is that there's never can be an allergic reaction to this because it's your own tissue.
Right. It's amazing, amazing. All right, so I can't wait to have this done.
All right. Okay, so we're going to start cleaning off your face. I prepared the PRP.
Yes.
And clean off your face and then start injecting.
What's PRP?
Platelet-rich plasma.
There you go. All right, guys, so I'm a little afraid, but
Don't be
so what
afraid.
happens next? So you're cleaning off my face, and then what happens?
And then I'm going to inject the areas that are that need some, let's say, reinforcement. And
so again, this helps. A lot of times people come in and they want to help just one area of their face.
Right.
Right. And normally that's the jowls or the labials or.
Correct.
Right. But this helps all areas of the face.
It's full face aging. It'll help all areas of the face.
Right. Okay. All right. So you are doing this under the eyes.
Yes.
Tell me all the places you're going to do it.
So I'm going to put it under your eyes. We're going to do it in the cheek. We're going
Yes.
to do it in the nasolabial folds, and we'll do it in the jowl area.
Okay, very good. Now, when people come in, what would you say that their biggest fear about having this done is?
Biggest fear. People don't, especially first timers, they don't know what to expect, so they're a little nervous.
Yes.
Anytime getting a needle in the face, fills somebody with a little bit of apprehension, so they're a little nervous. Needles are so small, but virtually painless. Most people don't have a problem with it.
Okay.
Some of the fillers have lidocaine in it already, so it helps to numb the face as we go along.
Okay.
Okay.
All right, very good.
All righty.
Now we see this all over the media, and I think one of the biggest is when Kim Kardashian had it done.
Sure.
So I think there was also a little fear that was put into everyone because we saw her face afterwards.
Right.
So it was very red.
This is not going to be red because we're not using the skin pen at the same time.
Okay.
So your face will look almost as if it should look once everything kicks in and the full effect takes place.
Okay.
In a couple of days, all the fluid that's in your face will get reabsorbed, but the growth factors and the platelets are left behind, and those will stimulate the collagen regrowth.
Okay, fantastic.
Okay?
So while you're doing this, should we be quiet or can we talk? Can we talk?
I can talk.
Okay. So you have a lot of other procedures that Luminous Spa offers.
Yes.
So I wanted to talk about those and
So,
share.
So for facial procedures, we offer Ulthera. Ulthera is an ultrasound technique
Yes.
that's used for laxity. It's used for skin laxity. So as you age, again, the collagen fibers, it's all about collagen mostly. The collagen fibers get very disorganized. They break down, so you get laxity. You can get laxity under the chin. You can get laxity around the eyes where your eyebrows droop a little bit.
Yes.
You get laxity in the jowl area. And what this does is it works underneath the skin. It's almost, it's not like a diagnostic ultrasound, although the ultrasound waves are the same. The way the machine works is it focuses those ultrasound waves into a focal point, almost like a magnifying glass focuses light.
Right.
And what happens is that it causes heat under the skin, and it causes the collagen fibers to get destroyed.
Oh, wow.
Once those collagen fibers are destroyed, the body builds new collagen, and it builds it in an organized way, so it helps with tightening of the skin.
Right. Which
So-
so often it's the tightening of the skin. The collagen has broken down, which
Correct.
is why that's happening.
Correct.
And so there's the drooping and fine lines. Are those the two things that we're fighting against with aging?
Finally, it was basically the collagen loss.
Yes.
And again, the support structure of the skull
Yes.
changes, so everything on top of it is kind of moves also.
And lasers and ultrasounds, these are all very new procedures.
Relatively new. I mean, certain things have been around for a period of time, and we found new ways to use them.
Okay.
Okay, we use the Fraxel laser. Fraxel laser
That's a big one, Fraxel.
is a laser that helps to build new skin. So it helps with skin pigmentation. It helps with fine lines and wrinkles. It helps with scarring, and it also can be used anywhere on the body.
Oh,
Scars
wow.
off, surgical scars that are unsightly can be managed with those. Can be used for hyperpigmentation in any other place on the body. But again, that's a very good procedure for people who have those problems.
So the Fraxel's so popular. I had a friend that had acne. She had it done, and it was just amazing how beautiful her skin came out.
It does. It really transforms your skin. It can
Yes.
help with really bad acne scarring. I've had several patients who were, almost shut-ins because of their appearance,
Yes.
and it's kind of turned their lives around where they're able to socialize, go out, and lead normal lives.
So what's really beautiful about this is it can be life-changing
Absolutely.
for somebody.
Absolutely.
There's the vanity involved that we don't want to have the fine lines. We're getting older, and we can have some help and still look natural. But if somebody really has something serious that's gone on, scarring, or like major scarring, like I have a scar on my face. I fainted, and thankfully it's healed, and you can't see it so much. But that doesn't happen for everyone.
I had one client especially who had severe acne scarring, and she was also in an automobile accident, so she had scarring on her face, and she was very distraught, and she came into me, and I told her she had gone someplace else and had gotten some treatment, which I didn't know what it was, but I was able to help her, and she was really thankful after the last treatment.
It's amazing. So all right, well,
All right, we're ready?
let's start this.
Okay. All right,
Okay.
Put your head back.
So again, for the
Relax.
faint of heart, turn away.
Put your chin down a little bit.
Okay.
Okay, good. Ready?
No.
Small pinch.
All right, it doesn't hurt. How many injections will you?
It depends. It's kind of a dynamic thing, so as we move along, we'll see how
Okay.
see how you look.
So it's okay right there in my scarring, right there?
Yep.
Okay. I feel it. Now, there's kind of a tingling sensation. That's normal.
That's normal. You can just put your chin down a bit. Good.
Okay. Ow.
Sorry.
That's the scar tissue there.
Just a little bit here.
Okay, so if someone is not as brave as me, because I didn't have any numbing cream.
Okay, we can put numbing cream on the face.
Okay.
Also. That helps.
Yes. I should have thought about that while I was sitting here. So, Dr. Maggio, you have completed all the injections.
Yes.
And what is happening now? I can feel it a little bit in my face.
So you're going to feel some fullness in your face just because there's some volume in your face. I injected liquid.
Yes.
So basically what I did is I injected under the eyes. So that puffiness under the eyes is gone. I gave a little bit more volume to your cheeks. And I decreased the nasolabial folds. And I helped a little bit with the jowls.
Okay.
So over the next few days, that fluid that's in there will dissipate. And then the growth factors and the PRP will be in the area and stimulating your collagen to regrow and hopefully get to this end point.
I see. How long does it take for me to look completely refreshed?
We reevaluate you at 6 weeks, and we'll see if you need another treatment or not. If you're happy with the way you look, then we don't necessarily have to do anything.
All right, and how long does it last?
It can last up to 2 years.
Wow, 2 years.
Yes.
So, but if it does, let's say in a year you say, oh, I feel like I need a little more.
Then come on back in and we can take care of you.
And is this okay to continue doing?
Yes.
It
Yes,
is.
completely safe. Again, it's your own tissue.
Okay.
There's really no risk of any allergic reaction to it. And it can be done as often as you like.
All right. And then I just look refreshed, right?
Absolutely.
Like I had a good night's rest.
Absolutely.
I just had the vampire facial done, but we're going to talk about some other treatments that you have
Absolutely.
here.
So a couple other treatments that we have that we can offer clients are, one is cool sculpting. Cool
Yes.
sculpting is a procedure whereby we freeze fat. The fat cells die and never come back.
That's
So
incredible.
Basically, it's used for people who have trouble areas, love handles, flank areas, under the arms. Women sometimes complain of the bra fat area.
Yes.
And it helps with all those areas. Certainly, it's not for losing weight.
Yes.
That we don't advocate for. It's just for those problem areas that are hard to get rid of, and somebody who is at a good weight and somebody who exercises regularly but just can't get rid of those areas.
Right, and we all have those areas.
Yes,
So there's
yes.
areas in our bodies that we have extra fat cells and such, and it's hard to get to, right?
Yes, and it
And
helps that.
reduce those fat cells.
Gets rid of those areas.
I see. And that's natural, so it kills those fat cells?
So basically what it is people lose and gain weight because the fat cells take in fat and they lose fat depending on where you are in dieting or weight gain. So you're born with a finite number of fat cells.
Yes.
What Cool Sculpt does is it actually kills those fat cells by freezing them. The fat cells get reabsorbed and really never come back, so you won't gain fat in that area again. Those fat cells aren't there to take up fat.
Unbelievable.
So it's actually a pretty remarkable process.
That's very cool. And then you also have IV vitamin therapy.
We do IV vitamin therapy, and it's kind of made for it's individually made for the problems that people are having. We offer just plain vitamin therapy. We offer some nutrients. We offer some vitamins, minerals, and things that just help processes. We do vitamin therapy for skin.
Yes.
That's healthy for skin. We do vitamins on people who are just not feeling down. Kind of pick them up a bit. Hydration. So it helps a lot in those areas.
So it's like beauty from the inside out.
Correct.
Right?
Correct.
Because if we're healthy inside,
Then you want to reflect that outside, and hopefully it shows that way too.
absolutely, absolutely. So I think we touched on all of the processes. And
We have a new one that we actually
have a new one.
that we are helping, and it's actually geared for men, but women benefit from it too. It's for men who have any type of erectile dysfunction.
Right.
From performance issues to pure erectile dysfunction, anywhere from people in their 30s or men in their 30s upwards. And basically what it does is it uses shock waves that are delivered to the erectile tissue in the penis that cause the release of growth factors for blood vessels. It causes the improvement in the blood vessels that are there, and it causes the growth of new blood vessels. It can be used in conjunction again with PRP, and it's shown to improve performance and erections in 85% of the people who have it done. So it's a non-invasive procedure.
All right.
No medication, and it's very, very painless, and results are great.
Well, Dr. Maggio, thank you so much for being on the show.
You're welcome.
You have another spa that's opened up.
Yeah, so what we're doing is we're taking the medical portion of the spa out of here.
Okay.
And we're opening a new location on Springfield Avenue. It should be open in the next 2 weeks, and it's going to be called About Face at Luminous.
Oh, I like that.
So.
About Face at Luminous. All right, and to find out about this, they can check out all this information on the website?
It'll be on the website, and you'll have the information of what procedures are being done there.
Okay.
And some new and exciting things are coming too.
That's fantastic. So luminousmedsalon.com.
That's it.
Is that correct?
Correct.
Thank you so much for
Thank
being
you very much.
on the show and for my vampire facial.
I'm glad you made it through.
I'm telling you, it was not so bad at all, and I'm already seeing the results. So
Great.
thank you so very much
You're
for
welcome.
sharing with me and the audience on how simple the procedure actually is.
You're welcome.
Well, wonderful. Thank you all for joining us, and we'll see you soon. Remember, you can download our show on the NJ On Air app, which is available on Roku, Android, and iOS devices.